Good afternoon and a warm welcome to our audience. I'm Dr. Madhusmitha from 2050 Healthcare. Did you know that falls are a leading cause of injury related deaths among older adults in India? With hip fractures accounting for approximately 52% of all fractures in this age group. Falls and fractures in the elderly pose significant risks, contributing to serious health complications and diminished quality of life. In today's session, we aim to dissect this pressing issue, unraveling preventive strategies, rehabilitation techniques, and the pivotal role caregivers play in safeguarding the health of our senior population. For this, we have today a special guest. Let us extend a warm welcome to Dr. Sarang Kanade, an esteemed trauma, joint replacement, sports medicine, and arthroscopy surgeon. With a distinguished background in orthopedics, including an MS from KGMU, he brings invaluable experience garnered from his tenure as an ex Indian Army medical officer and ex senior resident at Civil Hospital, Lucknow. His expertise spans across trauma care, joint replacement surgeries, sports medicine, and arthroscopy procedures. Dr. Kanadi's commitment to excellence in patient care and his extensive professional journey make him an invaluable addition to our gathering today. We eagerly anticipate delving into the realm of orthopedic medicine under his expert guidance. Now, let's delve into the heart of our discussion with Dr. Kanade by exploring some pertinent questions related to falls and fractures in the elderly. So, the first question for you is: what are the common causes of falls and fractures in elderly individuals?
Depending on the age and sex of the patient, there are uh, many causes of the fracture, and the fracture which can be classified as a geriatric fracture will involve some particular bones depending on the type of the fracture. So the fracture, the geriatric fracture or the insufficiency fractures will most commonly will be affecting the spine, distal end of radius, that is the wrist joint, and around the hip joint. If we consider the registry of this geriatric trauma, it causes a colossal amount of economical loss or economy drained over the insurance companies because of this geriatric fracture, and which is a purely avoidable fracture. For example, if a lady who is postmenopausal, she gets up at midnight, goes for a washroom, and she falls there. What relatives narrate that the patient went, that his or her mother went to the washroom, and we found her fallen at the on the floor, and thereafter on a screening or on examination, the orthopedician or the physician attending has said that she has a fracture at her hip, around her hip. So it's not that she fell and had a fracture. It's the fracture occurred and then she fell. This is because of the insufficiency. It's just like graying of your hairs and then falling. The same phenomena. The bone is so extremely weak after the menopause in female patients and after 65 years in a male patient, that too in an Indian or South Asian setup, that the patient will have fractures and then he will fall unless and until he has any trauma to it. So these are insufficiency fractures or geriatric fractures because of osteoporosis.
Thank you, sir. Moving on to the next question: how does osteoporosis contribute to the risk of fractures, and what preventive measures can be taken to maintain bone health in the elderly?
As I said in the previous question, I was emphasizing on it that in geriatric age group, the fracture occurs most of the time, almost always, because of insufficiency, that is osteoporosis, lack of calcium and lack of protein in the bone. and few hormonal imbalances. So the geriatric fractures can be prevented with few precautions in a perimenopausal age group for a female clientele and in a male clientele with few supplements and lifestyle modifications. For example, if a female patient postmenopausal comes to you with a hip bone pain or a backache, she should always be scanned for bone mineral density scan. That will give you the possibility of having a fracture in hip, spine, and wrist joint. So, according to the T score that we get in a BMD scan, patient can be managed accordingly. They can be given hormone replacement therapies like parathyroid hormone. These are the injections. These are uh, now the parathyroid hormone injections are made very cheap, so they can be given, and it reduces the probability of having a fracture in a geriatric age group by 80% and improves your overall bone strength. Second, if the patient is terminally ill and in a very high risk group of having a fracture, then he should always be under supervision while even for doing activities of daily living. That means he should always have an attendant along with him. Ambulate with the assistance of walking stick, walker, that too under supervision. Whenever these patients go to washrooms for their personal care and hygiene, they should be having an attendant outside the washroom so that they don't be lying there for a longer time even if they have some fall. They have an immediate attention and can be taken to the physician or surgeon nearby. So, few lifestyle modifications and geriatric fractures can be prevented.
Thank you for sharing your insights, Dr. Kanade. Now let's move on to the next question. What are the most common types of fractures seen in elderly patients after a fall?
It depends where the fracture, how the patient has fallen. If the patient has fallen from a standing height, mostly these geriatric age group or osteoporotic patients give an history that it wasn't a high velocity trauma. I was walking in the house, the stool slept, and I had a fall. Then, if she has a fall on an outstretched hand, then she may develop a fracture near the wrist joint, that is distal end of radius, which is a very common fracture. If she falls from a standing height on her hip bones, then she may develop fracture around the hip joint. It can be fracture neck of the femur, which requires a larger surgery starting from hemi replacement arthroplasty to the total hip replacement depending on the age and functional demand of the patient. Patient may, if even the patient falls from a stool or directly on the floor, patient may develop a fracture of a spine. But fortunate enough, these fractures of the spine are classified into a stable fractures which do not generate any neurological complications in geriatric age group. Very few patients require spine surgery after spine fractures in osteoporotic patients. So that is the best part, but still the fractures need to be noticed and managed accordingly, according to the age of the patient and according to the functional demand of the patient.
Thank you, sir. Are there any modalities to identify who are at a higher risk of fracture?
Yes, definitely. If you get a bone mineral density scan, it gives you T score. The T score will give you an estimate uh, that whether the patient falls in a low risk of fracture, high risk of fracture, or a very high risk of fracture, depending on the portion scanned. The BMD scan gives you the chances of fracture in the wrist joint, in the hip joint, and in even in the spine fracture. The patient having score less than -2, they have very high chances of having a insufficiency fracture or a geriatric fracture or an osteoporotic fracture. So BMD scan is a very handy tool, and the patients whom you think that this is a high risk case should be evaluated and managed beforehand for osteoporosis. Patients with diabetes, with hypothyroid, with smoking, these have higher chances of osteoporosis and poor bone quality as compared to a non-smoker, non-hypothyroid, and a non-diabetic patient.
The next question for you is, sir, what are the treatment options for fractures in elderly patients, and how does treatment vary based on the type and severity of the fracture?
So the treatments, there are many modalities of treatment available for this geriatric fracture or osteoporotic fractures, but it depends on the site of the fracture. For example, if a patient has a fracture near the wrist joint, so mostly these patients, if the fracture is a stable pattern, not involving joint and less comminuted, then patient can be treated in cast. Any fracture around hip joint has to be operated, needs and surgical interventions depending on the type of fracture, whether it can be fixed with an implant or whether it requires a replacement, hemi replacement or total hip replacement. It purely depends upon the site of the fracture, but the fixation modalities vary depending on the type of the bone quality. So, the bone quality is a very important component while deciding the modality of treatment for a geriatric fracture. The spine fracture, as I mentioned earlier also, those are mostly, since they result out of a very low velocity trauma, those fractures are mostly stable fractures and don't require any surgical intervention unless and until the patient has bowel and bladder incontinence or any other neurological complication following the spine fracture. So, the spine fractures can be managed conservatively with bed rest and a good nursing care.
Thank you, sir, for elaborating on the treatment options. Now let's proceed to the next question. How can elderly individuals prevent falls and reduce the risk of fractures?
Elderly individuals have to be treated and respected for their age and the age of that bone. It's not, you can always prevent a geriatric fracture. I will repeat, you can always prevent, provided they are, the high risk groups are recognized and managed accordingly. For example, if a lady in a geriatric age group staying alone, then she has a very high chances of having a geriatric fracture or osteoporotic fracture because there is no one to look after her. Even she has a trivial trauma, she will develop a fracture. But in the same age group, patient living in a uh, daycare center or in a geriatric care center or with a family, she is always under supervision. So there are less chances that the patient may develop a fracture. These patients should have an assistance while ambulation, while activities of daily living. So, if the patient is under supervision of either her own attendant or at a geriatric care center, so these fractures can be avoided to a great extent. And the trauma of the surgery and complications of the surgery can be always avoided. These are the responsibilities of the society. But as a treating doctor or as a physician or as a surgeon, I would always prescribe that the patient should be maintained, should have a good healthy diet, high protein diet, take calcium and vitamin D doses or supplements at regular intervals, and have regular visits at orthopedician or her geriatrician, so that she is always under a proper guidance.
Thank you, sir. What specific services does home care offer to support elderly or disabled individuals recovering from fractures or falls? And how do these aid in their rehabilitation process?
Daycare centers is a very underestimated name, basically because of the cost. But if the Indian population realizes that the amount of cost which will be spent after a surgery or after any disability in a geriatric patient will be less as compared to the geriatric home care. Since we have been born and brought up in a uh, joint families, so the concept of having a geriatric age group is a social stigma as well. The society doesn't believe in this, that society may think that this particular individual doesn't want to take care of his father or a mother, and that's why he has dumped him to a geriatric care center. No, it's not like that. We have to come over this stigma. The geriatric home care has a very important role to play in preventing and rehabilitating the disabled ones and their care as well. In a geriatric care center, the patient is continuously under monitoring, having a specialist round the clock, rehabilitation, and dietary supplements, which are required different for different patients. A diabetic patient will require a different diet plan as compared to a non-diabetic one.
Thank you, sir, for sharing your insights. Let's continue with our discussion. What role does rehabilitation play in the recovery process for elderly patients after a fracture? And are there specific exercises or mobility aids that can help improve balance and prevent falls?
For every fracture, rehabilitation is equally important, whether it may be a normal high velocity trauma fracture or a low velocity trauma geriatric fracture or an insufficiency fracture, osteoporotic fracture. Rehabilitation uh, is equally important as the surgical part. Unless and until the patient is rehabilitated proper, patient won't benefit from the surgery or any intervention for the fracture if the rehabilitation part is not being taken care of by a specialist or is neglected by the patient. So, for example, if any fracture around the hip, whether it was operated for hemi replacement, or fracture fixation has been done, the patient needs to follow a set rehabilitation protocol for better recovery and good results. There are few modalities which assist the patient in ambulation following surgery, and the patient is prevented from having a fall. Since after surgery there are another additive factors, the patient may be having pain, patient may not be so confident on bearing weight over the operated limb or a fractured limb. So he needs an assisted ambulation. These are all parts of rehabilitation.
Thank you, sir. The next question for you is: in what ways does home based rehabilitation differ from traditional clinic based rehabilitation for patients recovering from orthopedic injuries or surgeries? And what are the advantages of each approach?
There's a vast difference. It's the same as getting a home remedy for any disease or any illness and going to a specialist. Home care center is a specialist, and keeping the same patient at home is home care remedy. If you have any geriatric patient who needs a geriatric healthcare center, will be better looked of in a geriatric healthcare center as compared to a traditionally home care. Either you have a dedicated paramedical staff at home to look after him, or you have the patient admitted for rehabilitation or his care at a home care at a geriatric center or a daycare center for the patient.
Thank you, sir, for highlighting those differences. Let's move on to our final question. What should family members or caregivers do in case an elderly person experiences a fall or sustains a fracture? And are there any advancements or innovative techniques in orthopedic care tailored for elderly patients at risk of falls and fractures?
Orthopedics has advanced to a great level in last 2 decades. The caregivers or the patient's attendant at whoever first sees the patient, his duty is to immobilize the patient, make him comfortable so that the fracture is not in a mobile stage. If the fracture is in a mobile stage, it's moving, then the patient will have excruciating pain. So the fracture has to be stabilized first along with a splint or some harnesses so that the fracture doesn't move. There should be minimum mobility at the fracture site, and then patient is to be transferred or referred to a specialist for a definitive care. The implants have advanced in last 2 decades. There are few implants which are specially designed for geriatric fractures around the hip, and same with fractures around the wrist joint.
Thank you for addressing these questions, Dr. Kanade, and for sharing your expertise with us today. As we approach the end of our session, we want to express our sincere gratitude to each participant for their active engagement and contribution throughout the session. We believe that the insights and discussion shared today have provided you with valuable knowledge and practical strategies. A special thank you to our esteemed speaker, whose expertise and insights have greatly enriched the session. As we conclude, we encourage you to stay connected with us for future events, ongoing discussions, and opportunities for collaboration. Thank you once again for being an integral part of 2050 healthcare with you in every step of healing.